This video will go through the pre-op appointment guide that we use here at Granite. This helps you as patients have a couple other questions or ideas prepared in advance for that final appointment with your surgeon. So it's linked below, a PDF is. We recommend printing it off and bringing it to your appointment or writing down the questions in your own words, just to make sure you get as much info as possible out of that session. The first thing we recommend that you ask is for a paper copy of your physical therapy prescription, as well as a paper copy of your specific protocol for after surgery. This ensures that you know what the timeline looks like for things like returning to weight bearing or returning to lifting, and make sure that you and your PT are in good communication too. We also recommend asking for what the best way is to get in touch with your surgeon. And if issues arise or you're seeing some concerning signs, where do you reach out to first? Getting that current contact info will be very valuable to have in case anything pops up. The next questions are about activity restrictions, including driving, lifting, and weight bearing. Again, these are going to be in your protocol, but make sure you know what is specific to you and your surgery and recovery to make sure you can follow those restrictions on the other side of surgery. As anesthesia wears off and as those initial pain meds kind of kick in, we usually feel kind of groggy and we don't always retain info very well. So asking these questions when you're clear-headed beforehand really helps to ensure that you follow all of those important restrictions after surgery. The next question is about pain management after surgery, including what prescriptions and over-the-counter meds your surgeon is recommending or providing you, and then similarly following up with who to contact if you have any issues, including adverse effects, side effects, need for refills, anything like that. The next question is about the typical follow-up schedule. So for many surgeries, they're going to see you at a set number of weeks out to make sure things are going well. So that's a great schedule to have in your mind going into that surgery, so you know when your follow-ups with your surgeon will be. The last question is to ask about all things related to management of your incision site or wound care. This is going to include dressing changes, the timeline for those, any supplies you'll need, and any other management specific to the types of closure that your surgeon uses. This one varies widely, so even if you're getting a repeat surgery on the other side, it's still very valuable to make sure you know what the current protocol is. Keep in mind that all of these are one piece of the puzzle. It's really helpful to get this info and chew on it beforehand. Make sure you watch the rest of our prehab playlist to get your wheels spinning for other considerations prior to surgery. And we also have our post-operative playlist for managing pain, managing swelling, and those first few days after surgery. So check them out.